So another case of bite imbalance correction at Dr. Gupta's Shriram Dental Care. We believe in philosophy, rebuild without reducing. Aim is to save teeth for life. We don't want implants. Implants are the last options. If you can save the teeth, because teeth have natural proprioception, means you come to know about how much pressure you feel. The sensation of feeling is there. Sensation is there. When you eat food, you feel that you know how much pressure you're putting. In implants, there is no sensation. So this patient had a query: why my teeth are wearing? Will I lose my teeth? Because he got one root canal done and one tooth broke in 10 years and he got implant done. Then another broke. I was about to place an inlay. Over a period of time, he lost many. 2 root canals. Means this was root canal, upper tooth. If you see, this is a root canal and a crown. This is a root canal and a crown. This is a root canal crown. This is a root canal crown. Then this is a root canal crown onlay, and this is a root canal onlay. So over a period of last 10 years, he was getting one tooth and to another tooth root canal, because whichever tooth became sensitive or broke or became painful, he did a root canal. And ultimately the root canal tooth, which is crowned or onlay, ultimately breaks. So he said, will I lose my teeth or will I have teeth throughout my life? I said, you will have it, but as and when required, a root canal will be done. Because he asked me, what can be done to save my teeth for life? I don't want to lose them. And they are wearing. I said, they are wearing. And they are wearing because their bite is imbalanced. So either we treat the symptom which you come for, pain, and then I do, which I have been doing it, which the world is doing, or I treat the bite. So he said, okay, I will treat the bite. I said, okay, I will treat the bite. So to treat the bite means I have to check the imbalance, whichever is bone. So this is bone. If you see, this is now exposed. He was using desensitizing. This broke slightly. So till now he was just getting one tooth after another, root canal crown, root canal only, and teeth were wearing. Problem was the teeth was wearing. They were wearing. They are wearing. Okay. So they are wearing. Now when they are wearing, they apply desensitizing paint like Sensodyne, Colgate sensitive. They cannot chew on one side, they chew on the side, the bite gets further imbalanced. And once the enamel goes off, it keeps on wearing. The dentin is very soft, it keeps on wearing faster. So, not to forget, in case you like the video, please do click on like, comment if you want to know something more, so that in next video I cover that, and subscribe to our channel to know further about how to do bite imbalance correction. Now, we said, okay, we'll correct the bite. So, with bite analysis, in which we do muscle examination, all muscles of mastication examination, this is a system where we do face go record, we do centric record. So, ultimate aim was to save the teeth for further wear and from further root canals. So, he said, okay, on 16th March we decided, and 7th June we finished almost. So, we started with this and we placed some continuous way. Not all of them were covered. Wherever it was imbalanced, we just added on. This was added on. You see this one? This is the original one and this is the added one. We just added on. So wherever, considering occlusal dynamics, we have to add, which is wherever enamel is not there. So enamel was added on and there was not a single root canal done after that. So we have added on the composite here. Each tooth is possible. Each tooth is finished. You can see from any angle. You will not come to know whether there has been added on. So each tooth is, this is added on, composite. Now, so not a single tooth, but the main part is equilibration. You have to distribute the forces. The forces are unequal, so we added on, which in between, this is a lower one, this is the upper one, and not all of them. So full mouth does not necessarily means root canal, crowns or all. You can save the teeth without doing root canal. See, we have added on these. If you see here, add on. This is the original. Okay, this is the original. Add on. So we rebuild without reducing is our main aim, main philosophy, and can see here, you can make out this is a canine tip. So without doing a single root canal, we have balanced the occlusion. Mock testing was done in between. We did a mock testing. So with that, whichever tooth we just decide which tooth requires balancing in between, and then we just add. So these were required to do balancing. Only lingual aspect of this, on some part of this, some of these. Underneath these, some crowns were there. 1 or 2 crowns were there, which we decided to change, or in some cases not change. The opposing tooth was balanced. So balancing is not necessarily changing all the crowns, not doing root canal for multiple teeth, not grinding a single tooth. It is just redistributing the forces by adding. It is just like car rebalancing, not alignment. There is a difference in concept of alignment and balancing. So balancing is distribute the load. So once you distribute the load, you can balance it. So here, this is a case, started with this and finished here. So just added on whichever is born. This is purely without doing any root canal, without grinding a single tooth added on. And this is a polished composite. Now, if you like this video, again I'll ask you to like it, subscribe, follow, and do comment. And in case you like it, share it so that more people know about balancing. They don't end up with root canals, crowns, because ultimately you lose a tooth which is crown, because enamel is shaved off. Implants are placed after the root canal tooth breaks. So we don't want people to lose teeth. We want people to have teeth for the whole life. So this is our aim.